People often think of the emergency department when they think of the trauma center, and it's a hugely important part of trauma care. But if you look at the acute care of the severely injured child, it's really only about 1% of that child's time that they spend in the emergency department. And so the trauma center has to do with not just that 1%, but the other 99% as well. And that 99% has a lot of other specialists involved. It's very typical for a child to be seen by a pediatric surgeon, a pediatric neurosurgeon, orthopedic surgeon, the emergency department physicians, all within the first few hours of their arrival. And beyond that, there's other people who are available. If your child needs to go to the operating room, there will be expertise in anesthesia for pediatrics there. If your child needs to go to the ICU, we have pediatric ICU physicians who do just that, only the care of children and only critically injured children. Injuries can be very painful, and we have a very strong commitment to keeping pain at a minimum. And that starts even in the emergency department. On our trauma flow sheet, we have an area designated for pain management. How are we doing for pain? And that commitment continues throughout your child's hospital stay and beyond, really. The child will recover better if the pain is kept under control. It's easier to do things like take deep breaths and avoid pneumonias and be up out of bed and to work with physical therapy and have dressings changed and go to and from the operating room. And all those sorts of things will be done better and sooner and more completely if your child is comfortable.